guys, this is Dr. B, the PT. Thanks for tuning in for our fourth installment in the Pulmonary Hygiene Toolbox. Today we're going to be talking about the active cycle of breathing. I was typing up the instructions for this and thought that was kind of silly and a little bit hard to explain, so I thought it would be easier to just show you. I teach this to my patients pretty often, so I'm going to teach it to you like I teach it to them. I'm going to stop along the way and kind of talk about different types of interventions that I provide at each spot along the cycle. I've also provided a printable PDF for you guys so that you can print it out and give it to your patients to use when you're teaching. After this, we're also going to talk about some extra little tips that can help patients move secretions easier. So, with the active cycle of breathing, we start very easy by just doing normal breathing. So I'm going to ask you to just sit there quietly and just breathe 5 times. Great, that's very good. See, you're already a pro at this. Our next step on the cycle is what's called diaphragmatic breathing. This is really just deep breathing. So go ahead and do some deep breathing 5 times. Now this is where I tend to get my hands on the patient if they need it. I like to facilitate a really strong diaphragm contraction with diaphragmatic breathing. So to do that, I put my hands around the base of the patient's rib cage and I tend to follow them in and out with their breath. Once we get to where the rib cage is contracting as deep as it can, you can provide a quick stretch cue inward on the rib cage to help stimulate a diaphragm contraction. If your patient has a fairly decently strong diaphragm as it is, you may not need to do this. If you want to break out here and do a little more work on diaphragmatic breathing, you definitely could because you've identified a point of weakness in your patient's skills, but we're going to talk about diaphragmatic breathing in a different segment. So after your patient has completed 5 diaphragmatic breaths, like that, you go back to normal breathing and let them do that 5 times. After they do their 5 normal breaths, we go back to diaphragmatic breathing. So let's do those 5 deep breaths again. You can get those hands on your patient again and give them the cues that they might need. It can also help to ask them to breathe in through their nose and breathe out through their mouth. And you can also use something called the triple sniff technique. So if you ask them to sniff in through their nose quickly 3 times, it can help stimulate that diaphragmatic breath. So try that on yourself and see if you can get that to work. You go back to normal breathing and let them do that 5 times. The next step on our cycle as we move up into this orange section is what I usually just tell the patient is huffing. But in the therapy world, we call it FET or forced expiration techniques. So what this basically is you're going to take one of those deep breaths and then follow it by a huff. Now, most patients don't know what huffing is, so I like to tell them a couple different things, but what usually works is I ask them what Santa Claus says, and typically they say, ho, ho, ho. I've only ever had one person say, Merry Christmas, but we were able to easily correct that. So once they say ho, 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 I ask them to force out their ho, ho, ho's as hard as they can. So it sounds like this. Typically, if the patient has secretions to move, at this point, they will immediately transition from a huff to a cough, and those secretions will move naturally. If they do not have secretions ready to move, and they've performed a couple rounds of this deep breath and huff, then you move back into normal breathing, and you continue the cycle around. You can also ask them to cough if, say, they already have an impaired cough mechanism, if they're post-lung transplant where they have a denervated lung that doesn't cough naturally, or if they have some type of neurologic condition, or maybe their diaphragm is just very, very weak and they don't just naturally get that cough stimulation. But continue around the cycle until they do have a productive cough, and then you've successfully completed the active cycle of breathing. With the forced expiratory techniques or the huffing, you can actually perform huffing at different lung volumes to kind of target consolidation in the bases versus in the higher segments of the lungs. The whole goal of this is to try to get your patient to expel some secretions. So there are a couple things that we need to remember. With patients who have COVID-19, they have an active viral process going on. The active cycle of breathing is an aerosol generating procedure. So if they are performing this around other people, those people are going to be at risk. So we need to make sure that we're performing this in an isolated space, so a bedroom with the door closed or something like that. You also need to remember that because this is an aerosol generating procedure, you are putting yourself at risk by performing this. So you really need to make sure that you have the proper PPE and you're wearing it properly when you perform this. Please also make sure that all tissues are discarded immediately and that everybody washes their hands after performance. You want to make sure that your patient is performing this hopefully 3 times a day, but I like to tell them to perform it after meals because that kind of times it to 3 times a day naturally. I usually ask them to do 3 cycles each time or until they cough. So if they cough something up after 1 and they feel like they don't have anything else, then they're fine. I don't ask them to do more than 3 because this can actually be very exhausting to perform, especially for our patients who are a bit lower level or who have a very weak diaphragm. So if they're having trouble getting things moving, they can always include this in their postural drainage performance. So have them lay on their side or have them lay on their stomach or assume one of your postural drainage positions when performing the active cycle of breathing. It's really important that we ask them to not swallow their secretions. Most patients will, and so you need to try to remind them to not do that beforehand and to spit these things into a tissue or a cup, depending on what you have available. So with their secretions, you want to make sure that you see them. Because if you're seeing things like white or clear or yellow, light yellow, maybe a little medium yellow, these things are probably pretty normal. But if you're seeing colors like green, pink, or brown, you probably need to be notifying the doctor. Green could mean another active viral or bacterial infection. Pink, and we could be looking at pulmonary edema, which needs to be addressed medically. Or brown could mean that there's blood in the lungs. It's also important to keep in mind that if your patient has eaten chocolate or drank coffee immediately prior to performing this, that their secretions may come out brown anyway from what's already been in their mouth. Make sure you advise your patient that they need to be drinking lots of water. We need to take in water to help keep their secretions thin and mobile, but also make sure you consider any medical comorbidities that they might have. If they have something like congestive heart failure that has a fluid restriction, we want to make sure that they're not exceeding that. You can also talk to your patient about using mucolytics, things like Mucinex, that will help break up or dry up the mucus that they have in their lungs naturally instead. As far as other techniques for helping mobilize the secretions during the active cycle of breathing, during the huffing segment of the cycle, you can actually have your patient use a positive expiratory pressure device if their diaphragm or their respiratory muscles are too weak to perform a good solid huff. That's actually going to provide some internal vibration to those secretions to help get them moving. The positive expiratory pressure device will do this for you instead, and you can read more about that in the second blog installment of the Pulmonary Hygiene Toolbox. Thanks for checking this out, and make sure to leave your comments at the bottom if you have any other ways that you've modified the active cycle of breathing to help patients with different types of diagnoses.